All right, thank you very much, Anthony. Well, the road to recovery looks a lot different for senior patients with COVID-19.
And joining us to talk about the return home from the intensive care unit, is the physical therapy required in order to go back to normal life? We have Nora and Dr. David Crombreen. Good morning to both of you.
Morning.
Hi.
Well, first, thanks for being here. We certainly appreciate it. Maybe take us through what that path home looks like, especially with all that we've been dealing with as far as the COVID-19 and the senior patients.
The roadmap, as far as we're concerned, is that there really are two different areas of concern. It's physical strength, and then there's cognitive awareness. And so that road to recovery is going to take a longer time than many families think. It's especially hard now with the COVID-19 and the restrictions to having people come in.
Yeah, I can imagine. And, with all having to be quarantined and things like that, just having to, separate from your family, how can you still kind of be engaged with your loved ones if they have to experience this?
Well, much of that is just what the family is already doing. The ability to make connections, and like many of the recommendations, make sure if you're not able to visit in person, then you make phone calls. You try to FaceTime. You try to do those things that will make them feel connected and engaged.
Yeah.
Often, families will hire in-home care. That's our company, is Seniors Helping Seniors. And we provide companionship, anything that can keep them engaged with what's going on and make sure that they're continuing to make progress.
Dr. Crombreen, what are some of the things that you've seen these patients have the most difficulty overcoming through this process?
I think the return to normalcy, the length of the transition back to their normal life from a physical standpoint. A lot of these people spend a lot of time on ventilators in the ICU, not moving. From a physical therapy standpoint, movement is medicine in and of itself. So if you spend a lot of time in a bed, not breathing on your own, just getting that aerobic capacity back, the ability to exercise and get that activity level up so that you can return back to all the things that you want to experience in life.
Yeah, you don't realize, we hear about it, but you just don't realize how long that recovery is. We don't hear about it afterwards. And I guess, how can you guys, stay safe? I guess if people want to learn a little bit more about what they can do, their loved ones and such, how may they go contacting Seniors with Seniors?
You can go to our website at Seniors Helping Seniors of West Michigan, and we've got information there, and we'd be happy to talk to you about options.
All right, thank you both for being with us this morning. We certainly appreciate it.
All right, it is 8:28.